Hello, everyone. This is Shad Race coming to you from Sam's Voices. I'm really privileged to be coming to you with a new episode after a long interruption, to be with a new guest talking about a new initiative and as well as a new involvement with Sam's Foundation and the society. I'm really privileged to be with Dr. Mohammed Saleh. He's born in Deir ez-Zor in Syria. And he graduated of Damascus University and currently living in Grand Rapids in Michigan, not too far from me. I am in Detroit, married with three boys, and he's clinical associate professor at Michigan State University, College of Human Medicine, primary care internal medicine practice at Trinity Health in Grand Rapids, Michigan since 1996. And he's a chair of medicine mission committee at SAMS since 2014 and participated and led more than 20 medical missions to Syria and Jordan since 2013. Dr. Saleh, thanks again for being with us.
Thank you. It's a privilege. Thank you for the invitation.
Yeah, just to get started right away, jump straight into the topic is tell us about your journey since you came to the US and what kind of obstacle you went through and how did you overcome to be the person who you are now?
Well, it's a long journey. It's graduated from Damascus University School of Medicine back in 1992. Uh, the goal was always to come to USA for training. Actually, I did my USMLE exam even during my medical school, like fifth year, 6 years. So I was already started residency almost immediately after graduation, 1993. Finished residency. The same hospital. Actually, I'm working in the same hospital since I came to USA. That's 93 to 2025. That's more than
Inshallah.
32 years ago.
It's
It's
amazing.
one hospital, one location, one city. It's a mid-sized town. It's great to raise kids. I love it. It's close to, if you get bored, it's close to Chicago or Detroit, where the big Syrian community and good Syrian restaurant if you get bored from here. But otherwise, it's a great town, and Trinity Health also is a great organization to be with. So I I don't think I will trade the town or the organization from any other place.
That's great. That's great. So I did, uh, mentioned earlier that you are leading the Syrian mission since 2014, but you have been participating in more than 20 missions in 2013. So tell us
Mhm.
how you started this interest and how it made you the leader of these missions.
Exactly. Yeah. As you know, we all went to medical school having something in mind about helping others, being available to help the sick, the poor, the needy. Then when you graduate, you end up getting busy with work and raising families. So really, you forget about that original goal that drove you to be a doctor. And then suddenly, obviously, after 2011, when the Syrian revolution started, start thinking seriously, how can I get involved? And then thank God to SAMS in 2012 during the SAMS International Conference in Turkey. We had the opportunity to, not medical mission, but semi-medical mission, where you can go to the Syrian refugee camp in Kilis, which is a small town at the border north of Aleppo, where the first wave of the Syrian refugees start coming to Turkey. So actually, I took my family, my wife, and two kids. We
Mm.
went there. We worked in the Syrian refugee camp in Kilis for 2 days. It was really an eye opener. Then in 2013, I had also another great opportunity. Group of five excellent SAMS members who planned a trip to eastern Aleppo, which was out of the Syrian regime control at that time. So we worked in a hospital called Al Qudus Hospital in eastern Aleppo for 5 days. This was that's what really drove me into medical mission. Then after that, it's a history. It becomes an addiction. Yeah, I mean, people who did medical mission cannot explain to you exactly what do you feel, but you feel like just that this is part of you. You want to do it again and again. And I got a call in 2014 from Dr. Ammar Ghanem, who was part of the board at SAMS, said that we want you to lead the medical mission committee. And of course, it took me 5 seconds to agree to that task. And the rest is history. So, alhamdulillah, it's a great opportunity. Again, it's it's hard to describe the feeling when you go there, and the best feeling is when you hear the dua. May Allah bless your family, your wife, your parents, your kids. This is the best part of the mission, is when you hear the dua from those poor people, and also when you make a difference in their lives. I still have like a large collection of patients who are still text me until this time, ask me questions and making remember me, and during Ramadan, during Eid, just making dua for me and my family. So this is I always tell my I love teaching. Obviously, I'm part of the residency program here, part of the student teaching also. So I this is one thing I teach the resident and the student: always make sure you have one week a year or whatever you can set aside to do medical missions. And actually, I should have mentioned that mom. Allah yarhamha, before she passed away, she had one advice for me. Said one day a month, make sure you set aside one day a month to treat the poor and the needy for free. So this stuck in my brain for a long time ago, and
Allah
hopefully she's hearing that right now. So.
Okay, inshallah. So this is very inspiring, especially as you said, the spark started with one mission.
Mhm.
So you walk us through your journey as a chair of the committee.
Mhm.
How did you start putting missions together? How you were able to pull people to come and have the same experience, the wonderful experience that you mentioned, and in terms of a growth over the course of years.
Exactly. Yeah. So I think Jordan was really the great success story for Sam's mission program in general. So we started going to Jordan in 2014. Initially, the missions were very basic. Basically, you call a few people, friends, and people who told you, please let me know. And so we gather and we meet like once or twice on Zoom, and then we'll go there without any significant preparation. Then us who went to Jordan frequently said, well, I think we need to really take it to the next level, to the upper level. So we started hiring staff. So we had a great office in Jordan with a great staff who did basically the all the groundwork, field assessment, see which specialty are needed the most. Got in contact with UNHCR, asking them for their database, like how many people, because some people waiting to have their gallbladder surgery, which is a given here. Like you can have your gallbladder within a week or two. Over there, sometimes they have to wait 2 3 years to get their gallbladder out. They have to
Oh,
basically suffer with pain for 2 3 years. So they did all the groundwork for us. The office in Jordan, we were privileged to have great staff who did the groundwork for us. So basically, we start looking for specifically for certain specialties. Like I think you had Dr. Hussami on your program a few months ago. He's a part of the great. So we have the three great success story in Jordan was the cardiology program, which we had 4 times a year, 3 or 4 interventional cardiologists will go there and perform life-saving procedures on patients. And also we start applying for grants. Boston Scientific start giving us free stents to take with us. So we really we had some good grant officer in our HQ in DC. So and then also we have a great ophthalmology program. We Dr. Rifai is Arif Rifai was also pioneer in that. So yeah, again, we started from very basic 5 or 6 people going there to sometimes actually we reached almost 97
wow.
volunteers. And some missions we reached almost up to 100 volunteers. And believe it or not, we started mostly here in the Syrian community in the United States, but eventually we reached a point where we got volunteers from Australia, from New Zealand, from Guam. We have one anesthesiologist came from Guam, European country, multiple countries. We had volunteers. We started actually. Initially, we were like knocking doors and calling people, asking for volunteers. And at some point, like in 2017, 2018, we started unfortunately turning down people because we had so many volunteers applying for. We will make announcement like 2 3 months in advance, and we end up with like 150 200 volunteers are interested. So Sam's reputation, I think we built a great reputation, especially in Jordan. I think there is another group who did missions in Lebanon, which also we Sam's also started going to Greece, cover the refugee camps in Greece. Uh, and then, of course, Idlib became available to us after the earthquake in 2023. And that's what also started another great successful SAMS program to cover Idlib between 2023 until 2025 when we had the liberation. Then, of course, 25 was the great event, well, end of 24. Then we start going to Syria. Now, this is our, we did, I myself did 4 missions in 2025 so far. Covering Damascus, and then also we start going to obviously Aleppo, Homs, Hama, Deir ez-Zor, and then recently our leader Dr. Hind Azari went to cover the coastal area, the Ladakhiya, Tartus. So we're trying to cover all part of Syria.
That was my next question to you, but I think you touched on it already. Now with the new revolution, new kind of government, and everybody kind of relieved,
Mhm.
do you think that the missions will go less, or the demand is still there, and you still we're gonna be building teams to go and help people in Syria, but with different connection, different kind of approach, since the pathway is more easy now?
Yeah, the pathway, like you said, it's very easy. We have a very supportive government who's looking for us to go there more often. We have a great office and a great staff in Syria. We started in Damascus. Now we have actually offices in multiple areas in Aleppo, in Homs and Hama, and we have an office even in Deir ez-Zor. And I think we started having some office in the coastal region. So the need is great. I think it's not just seeing patient. I think we're trying to focus really on education, educating the staff, or sharing experience with the experienced doctor over there, plus educating the resident and the fellows, which unfortunately there was a great lack of education for those for the fellows and the resident, and also medical student. We're trying to, as much as we can, focus on lectures, hands-on seminars, workshops, and the amount of hunger and thirst from those residents and fellows are amazing when you see them and you see the appreciation. We used to obviously thank God for the appreciation from patient, but now actually we see how much we're making our those mission making impacts on the medical education in Syria, because if you teach 10 people, then those 10 people can teach another 10 people. So the impact can be much greater by teaching people how to fish rather than like just do the fishing yourself. So it's
Okay.
it's really this is what our mission became much more impactful when we added the medical education part to our medical missions. So.
Yeah. So I know this is a final question. I know that you have maybe, as you said, a flux of people applying to come for missions. But in case there is
Mhm.
somebody interested to apply or to be part of these missions going
Mhm.
forward, what is the easiest way to do it?
I think the website probably would be the easiest way to do it. Also, the medical mission committee, its members, I believe it's available to almost most SAM's members knows us very well, or at least know some of us very well. But at the website will be the first step. So if you go in and click on them, I think there's a volunteer option in the website. You fill a base application with just your name, specialty, and then when you're available to go to Syria. And then the rest is we have a great staff who will reach out to you. And then also what we would do is usually the mission leader with the staff will reach out, and then also based on them, obviously on the field assessment, what specialty we need. And now SAMS also has a great structure where we have assemblies So cardiology has an assembly, neurology, primary care. So basically, we say, well, let's we have a mission. For example, I'm going with Dr. Basil Atassi to a mission in January. We need, like, I'll say, 3 cardiologists for primary care or internal medicine. So we reach out to those assemblies. So we make announcement that, okay, we need 4 cardiologists, and then we will start getting applications, and we will process those applications. So I think the assemblies will be a great way to start, and also the website will be a great way to reach out to us to join our missions. And we're trying to uh, the frequency of the missions. We're trying to make them. Initially, the excitement were great, so we're almost doing a monthly mission in 2025. 2026, we're gonna slow it down a little bit just to make it more organized and also more impactful. So
Mm.
we probably will do it 6 times starting 2026. Will be every other month. Will be a mission every other month. Also, we're trying to make it region specific. So rather than covering all Syria in one mission, we'll decide, okay, January will cover, like, for example, January will focus on central, like Homs and Hama, Idlib, and also Deir ez-Zor. In March or April will be a different region covered, like Aleppo. In November this month, Dr. Khalid Al-Ahtab is leading a mission to cover Al-Ghouta,
Mm.
suburb of Damascus, which was hit very hard during the revolution. So again, we're trying to cover multiple areas in Syria in each mission, inshallah.
Inshallah, perfect. Thank you so much for information. Final thoughts or comments now reflecting on your journey in medicine in the US as well, your mission with the SAMS. What's your final thoughts to the new generation coming on board?
Well, again, the new generation, I always remind myself, and also it's about when I went to Jordan, I went to one of the NGOs. We had a clinic in that NGO, and I saw quote from Ibn al-Qayyim, a very known Arabic and Islamic scholar, who said, there is a sweetness in the heart from helping others. Nobody can feel it except the one who does it. And then
Hi.
initially when you read it, but then when you think about it, really, it's when you do medical. Some people ask me, well, I'm a very busy guy. Can I just make a donation and just you guys can just use my donation to cover the
Yeah,
mission cost, which is fine. We always looking for some people to cover mission costs, but at the same time, if you close your office for 1 week, I know it's going to be a lot of income lost, but going there, really, it's a different experience. Nobody will regret it if you close your office for 1 week and go there. It's an experience that's
100%.
hard to explain.
I agree totally. Thank you so much again. Really, a very insightful interview for the current generation and the future generation. And really, thank you so much, Dr. Saleh, for all you have done for SAMS and the people in need. Allah yarham al-walideh, and I think she definitely hear you, and I definitely her prayers for you is very valuable and still alive till now.
Thank you for the opportunity.
Thank you everybody for watching us. Stay tuned for more episodes in the future. This is Shadir is coming to you from Sam's Voices in 2025. Thank you so much.